and I'd like to welcome our next presenter, Cherie Kapell.
If your heart stops beating, would you want heroic measures to restart it? If you are having difficulty breathing or protecting your airway, would you want help? These are examples of CPR, or cardiopulmonary resuscitation, discussions that I've overheard between patients and their doctors. Unfortunately, from the glazed over looks or the blank stares that I get from the patients, they don't necessarily understand what is being asked of them. I even overheard one elderly gentleman say, after hearing the code spiel, "Huh? You want to jump on my chest?" So there's a problem, and we need to solve it. What we know is that people are living longer. We know that as people age, they develop more multiple chronic illnesses. Only 10 out of 100 people with serious chronic illness will survive CPR. People avoid discussions about end-of-life care, and sometimes people become too sick to have these discussions. And yet we know that people want to be involved in their healthcare decisions. So what can we do? Well, there are patient decision aids that can help people improve their knowledge and even increase their risk of, or their accurate risk perceptions. And so what we have done is we developed a CPR video decision aid, and it has a realistic portrayal of what CPR entails. Contrary to what is seen on TV, it's not all about the glory, and some people don't survive. It also gives some statistics, and it really helps people understand what is important to them, values versus choices. So what I propose is I want to study people with end-stage renal disease. They've already had to make the tough life choice to live with dialysis, a life-saving technology. With these patients, I want to see if the CPR video decision aid is accurate, if it's acceptable, if it's understandable. I want to see if it improves their decision-making ability and helps have them understand what they're accepting or what they're not wanting. I'm a registered nurse, and I work in a critical care area. I run to codes all over the hospital. I actually work at RUH, which is the Royal University Hospital, for those of you who don't know. It's attached here. When I get to a code situation, I have to jump on the person's chest. And I want to make sure that they've made an informed choice with their family, with their doctors, so that I am honoring that choice. Thank you.